2 days ago, and let me come to you, Sandeep, first. 2 days ago, Delhivery said it is flying charters into India with oxygen concentrators and other essential supplies. What is happening on the ground right now?
There are several things happening actually on the ground. There are 3 or 4 different initiatives going on. The first one is we're actually trying to help people who actually already have quite a bit of load in various parts of the world, especially China, oxygen concentrators, other essentials out of Beijing, Shanghai, and Canton, trying to see how we can get those to India using both charters as well as putting it on a bunch of other flights. We're also trying to do the same from Southeast Asia, from Israel, from Istanbul, Amsterdam, so various parts of the world. That's the first thing that we're trying to do. So again, it's a combination of charters, wide-body planes, and trying to also use partner airlines to actually bring that stuff to India, where we will actually also support on-ground operations both in the origin markets as well as in India. That's the first thing that we're doing. The second thing that I think you mentioned a little while ago, Deepinder has already tweeted Save My India Foundation. So we're working with Deepinder to actually source concentrators ourselves and bring those to India, and then distribute them through various channels. So make sure people get those. And the third initiative that we're working on, which is still work in progress very much, is trying to see how we can get cryogenic containers airlifted from Southeast Asia back to India.
Okay, Delhivery also mentioned about increasing capacities on demand. Sandeep, what is the kind of response you've seen so far?
So there's been tremendous response. There've been some flight cancellations coming out of China. So people have a lot of loads that's actually stuck there. Just before this call, I was talking to a group of individuals in Delhi who've actually just got together among themselves, and they have a load of 1,500 oxygen concentrators in Beijing, and they need to somehow find a way of bringing them to India. We had requests for people wanting to bring something from France. I already talked about Israel and Amsterdam. So there's several locations where people want to bring stuff in. So we're working, as I said, again, we're working with partners. We're working with Indigo and Spice. We're working with FedEx and the charters to try to see how we can actually, as and when required, bring more and more capacity online. And we're hoping that all through this week, we'll be able to start bringing stuff in.
Okay. So as early as this week, let's hope. Moving on to Project StepOne, Raghavendra, your big focus is supporting home care and isolation care for COVID patients, especially as hospitals are now facing a massive load in terms of cases. Tell us currently, what is the kind of support that you've been able to provide over the past few days? What is the surge in the calls that you're getting on your platform now?
Yeah, so we have had a 7x surge in calls compared to the start of the month, Shruti, and the number of cases. The key for Project StepOne is in the past we could direct patients to go to hospitals or COVID care centers when they need, according to a protocol. But unfortunately now due to the oxygen situation, there are not enough oxygen beds. So we are not able to escalate the patients to somewhere else. So we have to manage them at home. So that means that, first of all, making sure that all the people are not panicking, making sure that they are having all the they basically have all the details about how they can isolate at home, identifying very early who are the high risk and the moderate risk patients, starting off with medicines at home, which we would have otherwise not normally done. But the situation demands that they start on certain medication at home to avoid their mortality and morbidity and their symptoms escalating. So this is one thing that we are doing. Another thing that we are also doing is working with ACT grants, working with on-ground foundations and aid organizations to provide both oxygen concentrators as well as oxygen cylinders to people who are isolating at home, as well as providing them details of facilities where they can stay for a while until they find a hospital which is able to take them. So these are the key things.
Absolutely, oxygen is the need of the hour. And right. And you said that you've seen a 7x surge over the last few weeks, and of course you're getting volunteers to sign up. We've seen players like Shiro's also, calling for volunteers to join. However, you're also including a lot of non-medical individuals to volunteer for this, to make calls, etc., to patients. How are you ensuring that this is safe for the patients? I understand that there is a training process involved, but given the severity now in the second wave, how are you ensuring that, safe advice and safe teleconsulting is taking place?
Yeah, so we have a very streamlined process around that. I think we have no choice but to use non-medical professionals, because we don't have trained non-medical professionals, because we don't have enough doctors to be able to take these calls. So what we do is, a vast majority of the patients who are young, who are asymptomatic, or their symptoms are very mild, we actually have provided or created a process by which the non-medical professional itself will counsel them on what needs to be done. Anything where a doctor needs to be involved, where a prescription needs to be given, where or where some clinical decision is to be taken, that gets escalated to doctors. In fact, we also have another layer in between. We have a layer of nurses, counselors, other paramedical staff, and even medical students who are helping us with this to manage this load. We, in fact, need a lot more hands, both doctors, paramedics, to be able to, because the cases are really surging.
Okay, absolutely. Let me quickly bring in Rohan now. Rohan, MapmyIndia is offering to install GPS tracking systems for free in transport vehicles across India, basically to ensure smooth, quick and uninterrupted movement of oxygen, vaccine, hospital bed and medical infrastructure. What is the on-ground reality? How many systems have you installed so far? And what is the kind of impact you're looking to create?
See, the biggest thing that we started to feel that people are facing is that oxygen is there, but it's not reaching the places and people that need it in a timely manner. And there were a lot of reports coming in that, oxygen tankers or other vehicles are being stopped at various places. And we felt that, the best way to bring about that transparency and visibility and ensure that basically no vehicle is being stopped unnecessarily is to provide them GPS tracking systems so that anybody and everybody who wants to monitor the location live and get to know the real-time ETA, expected time of arrival, can do that. And from our perspective, we thought we'll just make it available for free, just to help kind of smoothen out the supply chain. Response has been good. We just put out the tweet or the message yesterday or day before, and we've started to get response from, the tier 2, tier 3 towns. So Rudraprayag, Lucknow, Patna, Puducherry, smaller providers who probably don't have GPS installed. And for those cities, they are the major, transportation kind of nerve system for medical equipment. So, yeah.
Okay, Rohan, and like you mentioned, this initiative will surely help authorities track live location, get alerts, and most importantly, bring in transparency. Rohan, MapmyIndia also put up, COVID vaccination centers on its platform, which now I believe is open for all. Tell us, how does this work?
Yeah, see, the other thing that we felt through the last 1 year, and especially now, is this, easy to access, credible information about places to do with COVID near you. So last year we started mapping testing, treatment, and isolation centers and provided that real time to citizens. This year, right before the vaccine drive started on March 1st, we mapped all the vaccine centers that the government was planning to kind of, provide vaccines from. And that actually the government of India integrated into cowin.gov.in, which again will face a lot of traffic in the next few days as 18 plus onwards people kind of log in to find the nearest vaccine center to them or nearby ones, as well as then book their appointments. So the good thing is, and what we've tried to do is, we want to spread this information widely. So we've made these APIs available for free. This widget is just like a one line of code to integrate into any website and app, so that more people can benefit from this through their own app or their own website of choice, be it news or other daily use websites and apps, so that real-time credible information, especially related to my vicinity and neighborhood, is available to 130 crore Indians. So that's what we're doing with our real-time maps and APIs.
Right. Also, Rohan, the MHA today said that the government itself is using real-time tracking to monitor movement of oxygen tankers. How are you working with the government on this? Is MapmyIndia, working with any governments on this?
Yeah. I mean, see, the government actually mandated on Saturday that, look, all vehicles which are involved in transportation of oxygen or essential medical equipment must be equipped with GPS. We didn't want to kind of take advantage of such a mandate. We said we'll make it available for free, because the idea for the government was to mandate so that everybody gets visibility into the supply chain. And we just wanted to play our part to make sure adoption, commercials are not a constraint in these times of crisis. So we're working closely with the government to make sure that they get a unified view of all vehicles. So the government is taking it quite seriously, and
Okay, so you are working with state governments. Let me bring in Sandeep back. Sandeep, we are getting reports that your delivery partners have been affected due to spike in cases. Are you facing delays in deliveries, and how are you ensuring business continuity?
Yeah, people are definitely falling ill. Thankfully, we've less than 3% of our entire team actually is down right now. We have constant RT-PCR camps across all our facilities, and we keep very closely monitoring what's actually happening with people's health. They've planned for these contingencies. There's a lot of learnings from last year that actually is going into planning the system now. And then a few things have happened, right? First and foremost, the most important thing is to make sure that our people's health is monitored. So we're tracking that. We've set up isolation centers with oxygen concentrators and other facilities and medical support, so that people who are not serious don't need to go to hospital, and we can actually create a place for them to actually go to in the interim. So that's the first thing that we're doing. We're following all the protocols in terms of what we need to do at facilities in terms of testing, distancing, and all of that stuff, as well as what we're allowed to carry and not carry, what times we're allowed to work and not work. All of that's being followed. Our network also has got a lot of redundancy built into it. There's a lot of automation in most of our large facilities. It's systems driven. So we're able to manage and bypass parts of the network if it actually is in severe strain. And lastly, it's amazing to see people really double up. We've seen that for every single person that's missing, somebody else is actually doubling up. And we see that across the system. So our people have really stepped up to take over that extra load. But there are delays. There are going to be delays, and I think consumers understand that. That there will be weekend lockdowns where we're not allowed to deliver goods to them. We work within certain hours. In some cities, we can't go beyond 6 o'clock in the evening. At night time, most cities anyway, it's on curfew and doesn't affect us so much. But during the day, there are restrictions. What we can deliver is also, so we're focusing much more on the essentials. And so, yes, people are going to face some delays, but overall, we're managing it.
Okay, so delays on the ground, of course. I quickly want to understand also, while you've run these initiatives to help people in the pandemic, what are the challenges that you're facing currently on the ground? What is the kind of support that you're looking for? Raghavendra, why don't you just tell us quickly in a few seconds what kind of support that you want, especially since you're seeing such a big surge in the number of calls?
Yeah, the biggest support that we need is we need more volunteers, specifically doctors, to join the platform. And even 1 hour of their time can actually go a long way in saving a lot of lives and creating less panic and making people stay at home. I think that's the number one thing. The second thing is, there is a lot of volunteers and organizations looking to provide oxygen to people in the house, both cylinders as well as concentrators. Unfortunately, this is not always the best thing. You need, along with you need to give the right amount of oxygen, as well as you need to start the medication to these people as soon as you start giving them oxygen, whether it's home condition or a makeshift hospital or a step-down hospital condition. I would encourage all the organizations to use the facilities that StepOne can provide to be able to have all the patients whom they're giving oxygen get a prescription, get a doctor to evaluate the the condition of the patient as well as decide on what is the medication to give them.
All right, we've completely run out of time. So one final question, and if you can answer in like 20 seconds, what have been the big learnings for the future? What should we continue to focus on in case there is a third or a fourth wave? Sandeep, can you start with that? And then we'll go to Rohan.
Sure, very quickly. I think there's just two things: plan, and then vaccination. Make sure the vaccination drive is successful. I think those are the two most important things.
Absolutely. And Rohan, what about you? I think MapmyIndia is also coming up with a tool to fight unverified and unstructured data, which is a big problem today.
Yeah, absolutely. I think we as a country and organizations need to leverage technology. We're a technology powerhouse company, leverage the solutions that exist to smoothen out these supply chains. I mean, my hats off, first of all, to the COVID warriors, the healthcare workers and the medical equipment providers first. I think they're doing the primary job, but the secondary job is technology exists. People should leverage it to the maximum.
Okay, so one should leverage technology. Thank you, gentlemen, for giving us time and talking to us, and wish you the very best with all the initiatives that you've started. Thank you very much.